Okay, so it's taken me a while to get round to this one. I was very nervous about doing this, but I'm going to do it, and I'm not going to hold back. I'm afraid my conscience just cannot sit with this any longer. This frivolous, almost fraudulent psychological diagnosis of ADHD needs to be challenged. I'm coming at this, let me be honest, straight from the outset. I am coming at this from the position that there is no such thing. Okay, now of course almost all of you are going to turn off right now because that is not what you want to hear, and that is the problem. This is a diagnosis that's been nurtured and carefully crafted, and I suppose at some point unintentionally found to be very, very viral. But it must have become clear pretty early on to anyone with a brain that that is for all the wrong reasons. It's because it's telling people what they want to hear. It's because it's giving them a get out of jail free card. Okay, let's just be honest right from the get-go. What we are talking about here is a list of ordinary, although not particularly likable or worthy character traits. An inability to focus on things, especially when one doesn't want to focus on them because one does not find them interesting. An inability to engage task completion. A unwillingness or inability or just general lack of endurance with difficult things that require a lot of concentration. A tendency to get easily bored. These are normal character traits that have plagued half to 3/4 of the population forever. Right? The difference is that before we didn't need or didn't give people a get out of jail free card for that. Now we got one. It's called an ADHD diagnosis. And it's a catch-all get out of jail free card for a rising number of things. And we'll go on to that because that can include, being held to the same standards of others in education, at work, in terms of benefits. So this is got major ramifications, this gaming of the system, which is what I'm going to suggest ADHD is becoming. It's becoming a gaming of the system with helping professionals, aiding and abetting people to give in to their mental laziness and inability to do difficult things. And it's a shocking scandal, really, nothing less, right? So what are we talking about here exactly? Well, the best video I could find on this, which is very recent and very good, was by Dr Josef Witt-Doering, who runs the Taper Clinic. So I think the YouTube channel is called Taper Clinic. I'll put a link below. And in particular, he was interviewing Dr Sami Tamimi, not the only critic of ADHD, but one of the more prominent ones. Of course, the original one, if you like, or the original one that we all know best is Jordan Peterson, who went in on ADHD a good 5 or 6 years ago, although not particularly full on. But just to recap, Peterson's argument was that ADHD was effectively a social construct that came about when the factory and the school became the norm for adults and children. So clocks, a clock timetable, for which most boys in particular were unsuited. So was it any wonder that we saw an epidemic of hyperactivity amongst young male primates, e.g. human boys, when they have never in their entire evolutionary history been required to sit still for 7 to 8 hours a day, and now they were being required to do so. Not much wonder that you would see some difficulty in young boys being able to do that, right? So that, in a nutshell, was Jordan Peterson's argument. It was an incorrect diagnosis, if you like. So what you might call a medicalisation of normal human behaviour, a pathologization of normal human behaviour. So I wrote down Sami Tamimi's main points in his interview with Dr Josef, and they went as follows. ADHD lacks a biological marker. Now, in that, actually, it's not that different to a range of other psychiatric disorders, of course, which also lack a biological marker. The obvious one would be, say, for example, addiction. The problem with that is, or the difference if you like, both don't have a biological marker. In other words, there's no brain scan or blood test that can tell you you've got ADHD. But there also isn't one that can tell you you've got addiction. But of course the difference is that smoking a crack pipe for 23 hours a day is very, very, very obviously dysfunctional and terribly dangerous and is extremely observable. Being a bit bored and not really liking finishing reading the task that you got set at college is not in the same category, is it? So both these mental health, behavioural health or mental health conditions, if you like, are observed in behaviours, external behaviours, but one is just so much more serious than the other. That's the problem. As would be the case, say, for example, with schizophrenia, which also doesn't have a blood test or specific biomarkers as such. So there are a number of psychological and psychiatric conditions that don't have biomarkers, but the problem is the behaviours that make them obvious are so serious that it warrants them being categorized as a specific disorder. Whereas with ADHD, they're so normal that they don't really warrant being characterized as a specific disorder. So also the diagnostic thresholds are just too subjective. So we've seen this before with the new wave trauma, the small t traumas, the complex trauma as they call it now. These diagnoses are questionnaire led. You literally sit down and fill in a tick box questionnaire, and at the end of it you've got this medical disorder. Imagine if we did that with cancer. It would be insane, but you'd get similar results. You'd have lots and lots and lots of people in particular diagnosing themselves, thinking, well, I know that the answer to this is no, but I'm going to say yes because I want this diagnosis. And likewise, you could argue a lot of, certainly a lot of medical psychological professionals working in private practice also have a vested interest in you having the thing because they get paid for treating you for having the thing. So they also want you to say yes. When you've got biomarkers, of course, it's a lot easier. You either have it or you don't. So again, like a lot of other psychiatric and psychological conditions, the diagnostic threshold is entirely subjective. It is you sitting down saying yes or no to a range of questions, which of course you can lie or just get wrong or misinterpret. And I've said this before, I'll say it again. We are the therapy generation. We are not Japanese samurai of the 18th century or stoic Victorian dads. We are the generation that answers yes to everything when we're asked, does it feel bad, or did your mummy didn't love you, or whatever. We'll tick yes because we are the therapy generation. Okay, so the idea that this generation in particular would answer a questionnaire that's asked, especially when that person is clearly seeking some guidance one way or another, whether the thing that's wrong with them is this thing called ADHD. So they're actively seeking, in most cases, a diagnosis. The idea that that would be objectively filled out, that questionnaire, is very, very spurious. I don't think it would be. I think most of the people who are going for an ADHD diagnosis very, very, very much want to have it. And there's a number of reasons for that we'll go into. Some of them psychological and morale-based, and some of them are more cynical than that. It's money and status and security-based. The other point that Timimi made in this video was that rates vary enormously between countries and cultures. Well, obviously, because the questionnaires aren't dished out to every other person on the high street in Rwanda, are they? They're only dished out en masse in Sydney and London and Manchester and New York and Los Angeles and these kinds of places because there's a market for it and there's an appetite for it. And this sort of Marie Antoinette generation is looking to kind of cosplay being ill or being mental or whatever it is, and there's all sorts of vested interests in this social contagion taking off, right? So once again, it is highly you're likely to get a very, very high uptake in Western countries of, oh, have I got this quirky mental illness? Yes, I do. Whereas you're not going to get that in Rwanda or, you know, Botswana, because people are too busy trying to survive. They haven't got time to worry about whether they, you know, the fact that they can't concentrate on reading a book means they're mentally ill. They'd laugh at the very idea, quite rightly so. So the other point, family, educational, social and developmental contexts explain much of what gets labelled as ADHD. Yes, absolutely. If the family is, let's say, upper middle class, and usually most people in that family would go to university, but now it's 2026 and the kind of stern warnings that would have got you into studying for your A-levels in 1986 from your mum and dad don't work anymore, or don't seem to, and your 18-year-old just doesn't take any bloody notice of anything you say, then but they do in fact have the IQ to get to university, and you do in fact want them to go. Guess what? There's two people that it's going to work for to diagnose that young person with ADHD. It's going to work for them, it's going to work for you. Because you as the parent then don't have to look at what the hell is going on with the motivation here, or the fact that you can't get them to do anything. And it also helps them, because it helps them explain why they don't need to do anything. They don't want to do anything, like a lot of teenagers. I'd argue the thing that's changed is anybody else's ability to get them to do anything. No one else has any purchase on young people anymore. Parents don't have it, government don't have it, police don't have it, no one has it. They do what they want, and there's plenty of get out clauses. And this is the brand new one, the ADHD diagnosis. I can't concentrate, I need longer on the test, I need a couple more years out, I need this, I need that. So it's dependent on the family, educational, social, developmental context as to what gets labelled ADHD. Of course, some working class kid who you know, just isn't very good at reading, don't want to go to university anyway, will just go the same route that everybody always used to, which is that, yes, thank God, 70–80% of, if we don't need 90% of kids who can barely finish a book to get a first-class degree from Oxford University, then we don't have a need of some kind of contraption like ADHD to funnel them into higher education, do we? We just do what we always did, which is that they become welders and plumbers and something bloody useful, or go in the army, where you don't need, it doesn't matter if you can't concentrate on, you know, reading an entire book by Shakespeare. Right, so quite right, we need context here. Stimulants can alter behaviour in the short term, but that does nothing to prove an underlying disease process, was another point I pulled out from the video. So what he was referring to there is the medical amphetamines, let's be honest, that are almost always what is prescribed when you have this thing. So you have, and I'm going to suggest, a normal inability to focus on things. Like most people, you don't like reading books that much, and you probably shouldn't go to university, right? You should probably just get another job or do something action-based. But no, we're going to pathologize you and tell you that you've got a disease of focus and attention. Right, what's going to happen now with that? How's that going to help? Well, it helps for a couple of days because it makes you and your parents feel better, right, about the fact that something's wrong with you, that you can put your finger on. It's mental laziness is what it is, right? But you feel better now because you don't have to admit to yourself that it's mental laziness, right? So what will happen now is that the doctor may well offer you some amphetamines. Right, some drugs that are like a couple of molecules away from street amphetamine and methamphetamine, really. Okay, they are slow release, long acting, they're slightly better, but not much. So that's the upshot. You'll feel better for a couple of days, and then slowly over the next few years, as the foot-ups that you expect everybody to give you because you've got ADHD start to wear rather thin, and nobody really gives you a foot-up anymore, and you're 3 years behind everybody else, because you took the easy way, and you're now also using what are effectively amphetamines every day. Are you better off than you were when you started? Not really. And here's the worst bit, is the fact that those amphetamines work to help you concentrate on the first day that the doctor prescribes them for you is thought to be proof of the fact that you had ADHD in the first place. Well, my concentration would be improved if I took amphetamines. I used to love amphetamines when I was younger. I took tons of amphetamines. Guess what? They work for everybody. Problem is, it's not proof of the fact that there's anything wrong with you, obviously. Right? Amphetamines will work to increase anybody's focus, not just somebody with ADHD. And they are addictive for very obvious reasons, which is that they raise brain dopamine at the nucleus accumbens. And also just the social act of having a thing that makes other things easier. And you wind up reaching for it every time you don't feel good, right? So addiction is highly likely. So here's the bit where I started to sort of look out a bit and see what the sociological effects of this are, and they are huge, right? So in the UK at the moment, there's a big thing about NEETs, kids who are not in employment, education or training. And 70% of NEETs, according to a recent government report, are driven by medical problems, as if. We're talking about 18 to 21-year-olds here. I mean, it's shocking, really, isn't it? And of course, ADHD and autism, another load of neurodivergent nonsense that requires its own video. The idea that everyone and his brother now is autistic. I mean, if these people knew what real autism was, they would be shamefaced. It's like stolen valor. It's like pretending you're a soldier when you're not. Real autism is dreadful. Imagine being a parent with a child who really actually is autistic. And then imagine labeling yourself autistic. I've got autism because you think you're a bit kooky or a bit weird, or you just feel it would make you look a bit more special if you had that diagnosis. It's awful, really. This hyperbolic kind of concept creep around neurodivergent issues like ADHD, autism, Asperger's, these kinds of diagnoses being horrendously abused in the case of autism and Asperger's, which are real conditions. But ADHD isn't even real. It's a made-up nonsense diagnosis to make people feel better about themselves. And this is where the rubber hits the road, is a lot of these kids who aren't in employment, education or training are now being aided and abetted through that lack of participation in life or in society by a small army of helping professionals, psychological professionals, who are only too happy to stick this diagnosis on them because under some sort of misguided attempt at empowerment. Whereas in fact it does the precise opposite. It lends credence to the fact that they don't need to be in education, employment or training, which of course they do. In order to become a real boy, like Pinocchio, you need to get a job. You need to get some kind of direction. You can't sit around in mum's basement, in the proverbial basement. You need to do something. So you can pretty much bet that the massive explosion in nonsense ADHD diagnosis is driving a significant amount of the bullshit excuses that 18 to 22-year-olds give for not being in any kind of employment, education or training. And they are being actively aided and abetted by professional adults who've been trained in counselling and psychology to help give them that get out of jail free card. I can't do any of those things because I have ADHD. And one person who really caught my eye was a Lewisham headmaster who was going absolutely apoplectic at this. Lewisham being a fairly rough and ready part of southeast London where NEETs, kids not in education, employment or training, are presumably quite abundant. And he was making this precise point, and good on him. So let's go back through it. ADHD lacks objective validation. You might say so too does schizophrenia and addiction. The thing is though, with those two conditions, you can tell when someone's running around on the other side of the street, wiping imaginary cobwebs away from their face and gesticulating up at the sky, that all is not well and you need to avoid them. They are clearly, demonstrably, observably ill and suffering from schizophrenia. The same is true with addiction. When somebody is bent over double on the street, zombied out on fentanyl, or just absolutely off their head on crack, being an absolute danger to themselves and everybody else, again, you can pretty much and pretty easily tell something's wrong. With ADHD, I challenge you to spot what it really is. What is this? You're not following the script of the movie very well? Don't feel like making your bed? I mean, it's risible, isn't it? So there's no brain scans, no biomarkers. There isn't with other psychological illnesses either, but the thing with them is they're serious and observable, and this one really isn't. It's frivolous and non-observable. You cannot differentiate it from normal human behavior. It's just an extreme of lack of focus, an extreme of laziness, an extreme lack of endurance, and all of these things, while not easy to overcome, are overcomable. And at the end of the day, if you can't overcome them, that's okay too. Most people didn't overcome them. That's why they didn't go to university. That's why they gave up on the test and went out and did something else instead. What is shameful and ignoble about this is the fact that people get to not do that. They get to push through under false pretenses. Just admit that you'll never be able to read a book in your life and crack on and do something else useful. You don't need to make it ADHD and then waste all of our time and money going through some kind of support system. You don't need a support system. You're just the kind of human that doesn't operate well reading books and stuff. So don't do it. We also have diagnostic inflation, which we've talked about. So that, as I've talked about with things like trauma, is taking this usually fake diagnosis, which is really just a range of normal human behaviors, and pathologizing it and inflating it massively. So everybody has it, or anybody who's got any kind of complaint can have it attached to them. It's a category error, in other words. This is not a pathology. This is normal human frailty and variation. So it's a medicalisation of normal variation. And obviously children and people differ in temperament massively. All right, so we've covered all of that. We've covered the needs and the way that things like ADHD put bad behaviour, or at least really dysfunctional and civilization wrecking behavior. You know, large amounts of young people not doing anything constructive is really bad for us, right? And anything which aids that and gives it fuel is bad. And so this is one of the major columns in why we can't get young people moving, because we keep giving them a get out of jail free card, a free pass to invalidism, if you like, that doesn't really exist. It's hopeless. So around 1 million people in the UK are NEET, and that is projected to rise further. Huge amounts of them cite mental health or neurodevelopmental conditions as the reason for economic inactivity. No, it's sitting around in your bedroom doing ketamine and coke, playing games. They don't suffer from ADHD when they're chatting to each other on their phones, do they? They don't find that difficult to focus on, do they? Okay. Arguments. Welfare incentives and diagnostic expansion. I think we've covered that. All right, so how's about this? I'm going to put it like this. In previous generations, we would have called this things that we'd now called ADHD, and to some extent the frivolous autism diagnoses that are dished out as well. Once we would have called these things shy, distracted, anxious, awkward, immature. Now you get a formal diagnosis. It's the creation of a sick role, which is in itself obviously a very sick thing to do. And the concern here is that once a young person adopts an illness identity, work and education become less likely. And imagine that you've convinced this young person to take it easy right from the get-go. They have now failed to launch. They can't do this and that because they're ADHD. Do you think they're going to get more functional as they get older? No, they're going to get worse and worse. If they can't get to it at 21, 22, 23, and they've been given a lifeboat that they don't deserve, they're just going to drift out to sea further and further. Good luck trying to bring them in when they're 26, 27 and convince them that now they do need to do the really difficult things. Or good luck trying to create a society where we have to spend billions on helping what are really perfectly ordinary people just go about doing normal things because they can't do it because they're ADHD. There's no good end to this. So we've got Peterson's original criticism, which is that this is trying to put a square peg in a round hole. But the problem with that was when he was making that critique 7, 8, 9, 10 years ago, is it was still mostly boys that were getting diagnosed with ADHD. And even back then, a lot of us were going like, what? This doesn't make sense. This is normal young male behavior. Now, of course, it's really, really spread out, right? It's become a social contagion because lots and lots of girls and women are getting diagnosed with this now as well. And so what I'm going to suggest to you is what this Dr. Timimi said, I think is a brilliant idea. This isn't a medical diagnosis. This is a brand. This is a brand. ADHD is a brand. It's got real brand power. And now that it's been successfully sold to women and girls as well, we can see that Peterson's original critique doesn't quite fit anymore. We've got to widen it out further than that. It's not just young male behavior that's being pathologized and trying to make out that they're ill because they're just behaving like normal boys. There's also almost everyone, it's not even just young people anymore. People in middle age are getting diagnosed with ADHD now because no one saw it before, or you know, the services weren't there. Yeah, they weren't, thank God. There weren't you know, specialist practices set up just to make money off diagnosing people with ADHD. Yeah, there weren't, and that was a good thing. Now, I'm seeing 90+% of people coming into addiction treatment with ADHD of every age, every race, both genders, whereas before it would be 5%. Back in 2010, 2012, it'd be 5%, and even those we used to say there's nothing wrong with them. It's the drug use that makes them unable to concentrate. When they're not on drugs, they can't concentrate. When they stop doing drugs, they can concentrate again if they try, which oftentimes they don't. But it's not an illness, right? But now everybody and their brother is literally everybody. Almost every inquiry that we get will be, my name's John, I'm ADHD. And it's so widespread, it doesn't tell you anything anymore, right? So the old argument doesn't quite fit. It's not young male behavior that's been pathologized. It is a drug-using behavior, an unwillingness to confront life, deal with difficult things, a lack of endurance to see things through. And parents, of course, seem to be just as attracted to this pigeonhole, this catch-all, because it helps them stop worrying about their kids as well. Why can't he do anything? Why won't she do anything? Why won't they do this or that? Is it something I've done wrong? No, it's ADHD. Oh, thank God. As if it was that easy. It's mentally lazy to just take a diagnosis and, like a magic wand, to explain away all your problems. And within days or weeks anyway, you'll realize that your problems haven't gone anywhere. They're still well and truly there. And the Vyvanse, Elvanse, Ritalin, dexamphetamine, these medications that are prescribed to resolve it won't resolve it. They'll resolve it for a week. They'll help you concentrate when you're on them. They will also give you a range of other side effects. You know, years down the line, you will have to eventually come off of these, and it's not going to be easy. And believe me, you can concentrate, and you can finish tasks, and you can sit calmly and quietly and feel a sense of serenity without amphetamines. You can do it. And there are many, many ways of doing it. It's just exactly the same kind of intervention or procedure that you would follow if you were treating addiction, and to some extent even treating depression and other things like that. It is hard behavioural work, discipline and routine. Put the routines in place, because you won't be able to rely on feeling motivated all the time. And you put the routines in place of things like breath work, running if you can do it, cardio, things like that raise and elevate mood to combat your depression. Breath work, following a certain ratio of breathing, that can help greatly with your ability to concentrate. And perhaps only doing things that you do find interesting. Just admitting that that is really where you need to go. Don't try and fit yourself as a square peg into a round hole. If something's terribly boring for you, then don't go into that career. Find things that interest you. And above all, do not rely on nicotine, alcohol or other drugs to help you with your concentration problems, like everyone and their brother does. Everybody does this. Everybody relies on caffeine and nicotine. You're no different. But it will exacerbate the problem and make it very, very much worse. So stop doing that. Right? So, and again, John Haidt, another psychologist. So this is where it morphs with Peterson's argument, would be the argument of people like Jonathan Haidt, who would say smartphones, social media, sleep deprivation, reduced outdoor play, reduced independence, all of this results in shortened attention spans in everyone. And of course, especially in kids, but it's all kids. You know, you're not special, your kids aren't special. This modernity is affecting everybody, and of course it's affecting their attention span, but it doesn't need to be pathological, and it definitely doesn't need a label, and it most definitely, almost certainly doesn't need medicating, unless you've got some weird kind of narcoleptic disorder, which of course is something else. But this attention deficit thing, it ain't real. So that's John Haidt's argument. We've done Peterson's argument. We've done Timimi's argument. We've seen a child who's restless, novelty-seeking, impulsive, energetic. This is a normal child, right? Those things are really useful for certain things. Exploring, hunting, military activity, entrepreneurship, risk-taking. Perhaps we are trying to in a sense, trying to sort of feminize everyone, make them sit down and behave themselves. And some people just aren't built like that. Boys in particular, more physically active, more aggressive, more exploratory, and harder to keep seated. It's just a fact. So the idea that we need methylphenidate, you know, those kinds of amphetamine-like substances to treat this is shocking. That idea is widely accepted and widely sought by parents and people in general. Dreadful. So my argument would be that this is grift. You know, this is grift. It's professional grift on the part of a lot of psychological professionals who, if they used their brains and they were being really, really honest and they were really looking for an answer, would see that there are behavioural strategies called discipline and routine that provide a way out of this for almost anyone. Right? But it's not just, we can't just blame them. This is also grift on a personal level. People themselves looking for a diagnosis to make themselves feel better. It's a bit like, I'm getting older now, so I know a lot of people are a little bit older than me in their 70s and so on. And what shocks me sometimes, this is going to be controversial, right, but I'm going to say it anyway. What shocks me is the way they start frothing around desperately for answers when they're dying or getting ill. And what I want to say sometimes is like, put that ChatGPT down. Put that Google Doctor finger down. You're ill and you're getting old. But should I put the aircon on this way? ChatGPT, what is this? My finger's gone red. What does it mean? What does it mean? Should I do this? Should I do that? You're old. Like out there, there's an 8-year-old girl trying to cross the Sahara to find a doctor. And what she's got wrong with her wasn't self-inflicted. It isn't because she smoked 20 cigarettes a day for 40 years and got away with it. It's some crazy illness that's going to kill her. And when they find the doctor, most likely he'll tell them to bugger off because he doesn't want to see them or something, or they're too poor. And they'll drive 2 days home and not once will they complain. And that's what's so ignoble about this, I've got to be fixed. You know, so there are elderly people I know, you know, they'll get taken like round the corner to the state-of-the-art hospital, driven there, of course, by somebody, their sons or somebody, and they'll turn up at the state-of-the-art hospital that's paid for, either by their insurance or by the National Health Service or whatever, and everything will be wrong and not up to scratch for them. And they're coming to the end, they've had a long life and have, through their lifestyle, caused numerous issues that still hasn't managed to kill them. And they still complain. So this reaching for an answer that cannot be answered. The answer is that you're old and dying. Because that's the natural order of things. And of course, it is to some extent understandable that people, even when they're old and have had a long life, will still panic. But it's not noble. It's understandable, but it's not noble. And that's what I'm saying with this kind of thing. The grift here is personal with ADHD as well. You can't just blame the professionals. If you're looking for some easy answer to all your problems, you won't find it. And ADHD won't give it to you. I've seen this play out 1,000,000 times. It'll make you feel happy for a little while because you think you've got an answer. And I've seen this play out with people who've got all sorts of illnesses. Doctor tells them something hopeful and they're abuzz for a while until they realise it's not that. It's not that. The answer's more systemic. The answer, it will probably never be found out what is actually wrong. And in the meantime, you've got to get on and try and live nobly and as best you can. And so this is a kind of personal grift that the psychological profession is complicit in. And it's a kind of cowardice, really, on the part of the medical profession, because they should know better. And they seem afraid to call out what's really going on, which is a sort of collective burying of heads in sand is what's going on, a kicking the can down the road. It's not that my 18-year-old son is lazy and does too much ketamine and I've gone too soft on him for too long. It's not that he's got ADHD. No, it's not. It's the first thing you thought. And the problem with the ADHD diagnosis is it gives you permission to kick the can down the road. And all that's happened now is he's 22, not 20, before you really get into the problem. And what's more, he's been doing medical grade amphetamines from the doctor from the last 2 years, and he's convinced now he's got the doctor's note to do battle with you when you try and persuade him that he should do something else. Right? So no one's going to make you well with their magic wand. And this BS diagnosis certainly isn't going to. So these are, Timimi was right, these are not medical diagnoses, these are brands. Right, and when you start to really get into the neurodivergent spectrum totem pole thingy, you can see it for what it is, which is just another LGBTQIA 9754, whatever it's called now. It's just another spectrum of nonsense. A totem pole on which people like to place themselves to assert their victim hierarchy, as it were, or their leave me alone, I don't want to be made to do anything rights. It's just a protector of all of that dissembling, dreadful behaviour. Right? That's what it is. It's just a brand, a social contagion, an identity game, like something a load of 18-year-old kids on Reddit thought up. It probably literally really is the origin really of this social contagion that medical professionals, mostly psychologists I'm going to say, and counsellors, not GPs. GPs are the unwilling victims in all of this, where they get in neurotic people and parents coming and bothering them in their practices and saying, I want an ADHD diagnosis because it's going to fix all my problems. And he or she is just like, yeah, great, go out and see a psychiatrist or something. But the real willing champions, if you like, of the ADHD diagnosis are counsellors and psychotherapists and psychologists. They really love this victim spectrum of neurodivergence because they get paid and it boosts their status and their importance in all of this, because of course they are the high priest that will fix it or lead you forward. But you can well see how a lot of anxious, insecure, don't know where they're going young people would find some kind of comfort in this cosplay. You know, I'm ADHD, I'm autistic, as if you could get out of it. You're just a normal young person. Stop talking nonsense. The real crime really is that any adults are really aiding and abetting them in this nonsense, right? That's the real crime. So it's a collusion. It's one that's not going to end well for the beneficiaries, unfortunately. The ones who've been bestowed the victim status have had it bestowed on them. Yes, poor you need help with your tests. You can get longer to finish your school exams than all the other kids. I mean, how outrageous is that? Why can't somebody see that's the biggest grift ever? And we wonder why the rates of ADHD diagnosis are skyrocketing. It's because it helps grift. It's because it helps people freeload and get things they don't deserve. That's why it's taken up. It's profitable to do this. And you've got to ask yourself, at what point does everybody else not get themselves diagnosed? It's a bit like, imagine, it's a bit like we legalise steroids in all sports. Well, then everyone has to use steroids, obviously, if they want to be able to compete. It's dreadful. So they've gamed the system. But what's going to happen ultimately is it's not going to work. You're going to wind up economically inactive if you're not careful. If you're a young person and you're getting convinced by the adults around you that you're ADHD, take that get out of jail free card and throw it back in their face. Right? Because you're going to wind up economically inactive, and that will rob you of economic and psychological independence. As you go on through your 20s, it will not get easier, it will get worse. You will get further and further and further away from a point where even you can motivate yourself to start to properly launch into your life. Never mind if anybody else is willing to let you dock at their station now that you're 7 or 8 years late. Right? So my advice to you is do not allow them to candy floss you down into this doom loop, to give you the soma, you know, the soma medication like in Brave New World to pacify you. Because half the time they're just looking for their own answers. The psychological professionals are just seeking to validate themselves and their own importance and earn a living. And the parents oftentimes are extremely unwisely looking for a diagnosis that answers everything, because they don't know what to do with you, right? And if you're an older adult, then obviously don't play this game. You should have been around long enough to know now that you're changing your behaviours and gaining support of other people who are strong and going in the right direction and using routine can get you out of this stuff. Okay, so that's what I've got. I told you it wasn't going to be pretty, but the fact is there's no biomarkers for this thing, not in cardiology, endocrinology, nothing. Schizophrenia is scientifically proven, ADHD is not. Addiction is absolutely demonstrably awful, ADHD is not. Yeah. So, not pretty, will be controversial, will obviously annoy a lot of people. All I can say is I can't in all good conscience carry on pretending to give this diagnosis any succor whatsoever, really. And if there was one person out there who had a thing called ADHD, that this was actually a real thing in somebody, it would still be worth me saying this, because almost everybody who thinks they have it, you do not have anything wrong with you. And thinking that you do is not helping you or anybody else, in my view.